What's up everybody, my name is Dr. Jocelyn Conley, pelvic floor physical therapist, and in this video I'm going to go over the eccentric hip drop. The purpose of this exercise is to train eccentric control of the gluteus medius. This function or this role of the muscle is absolutely key for running and for walking. It is because of our glute medius that our pelvis can stay level, and therefore the rest of our leg muscles and hip muscles can work well during walking and running. When they are not working well, it puts excessive strain on different parts of our joints, in our hips, knees, ankles and feet, as well as our spine, and then everything that transmutes from the spine. What you'll need is, you might need a stick to hold onto or a wall and something to stand so that the floor is a little bit below you. You could do this without a step, but it's just easier to have a step. Now, your starting position is going to be in a neutral position. So your spine and your pelvis are in neutral. Your pelvis is level, otherwise your spine wouldn't be in neutral. Your ribs and your hips are stacked. You don't want to brace more than you need to, so just connect with your deep core if needed, or just pay attention to just getting in neutral and staying there. And what you're going to do here is your standing leg stays straight. And you'll see what I mean shortly. Your hip, knee, and ankle are straight the whole time in that they're not bending, okay? Although that is a variation. Then you're gonna drop your opposite leg towards the floor and then bring your leg back up with this leg. So dropping and then coming back. From the side so you can see what my knee is doing. Again, neutral, I'm dropping. Notice my knee is not bending. You can't see my back leg. And then I'm coming back up. On this side, so you can see my leg, dropping, and then coming back up. Where you will ultimately feel this, it might take some time, is gonna be your upper back pockets of your butt cheeks, right here. Ways to enhance this is to really connect with the ground with your feet. So pressure is through your heels, the ball of your feet, and you're essentially splaying your toes into the ground. The other thing is, as you're coming back up, you want to squeeze your glutes and make sure your knee does not cave in. Keep it in neutral. Squeeze your glutes to bring your hip back up. Control, let go as you go down, come back up. And then inhale on the way down, exhale on the way up. Common errors with this movement would be, as you drop down, your knee is bending too, which is okay if you are intentionally doing that. Ideally, I'd like you to learn with the hip first before you do that. And then there's just other exercises that are better to develop that than this one. So the knee bends with the hip versus knee and hips staying in extension. The other common error is with the back. So when you come back up, you're using your back muscles rather than your hip muscles. In the early stages of learning this, you may use both, and that's okay, but ultimately you don't want to use your back muscles on the side where the leg is hanging. Ways to work this is adding weight. Once you have your balance, or you can hold on to something, but once you have your balance, holding on to a weight on the side that's lowering is a great way to load this hip even more. Doing this on an unstable surface, so like a foam pad or something that rocks a little bit. Hard to do it on anything like a Bosu, but something with a little more give. And then ways to regress this would be, like I said, holding on to something, or doing this on the wall with a ball against the wall between your body and the wall. That way you have something, feedback to work against, and the leg that would be down would be the leg that's away from the wall, and then the other leg would be lifted and pushing against the wall. If you have any questions with this, please post them below. If you like this video, please like, and don't forget to subscribe so you're notified every time a video is dropped. My name is Dr. Jocelyn Conley. Thank you so much for watching. I'll see you on the next video.